government of Nigeria and at the invitation of USAID on behalf of the US government to receive valuable equipment to support Nigeria in the fight against the COVID-19 pandemic. We shall be taking delivery of medical ventilators to shore up our intensive care response capability, courtesy of the President and people of the United States of America. This donation consists of 200 modern ventilators, as I have just seen, which, as we all know by now, are a critical component of the response strategy to save the lives of persons who have been severely impacted by this viral infection. They will certainly be of great benefit to the people of Nigeria, and I wish to convey the appreciation of His Excellency Muhammadu Buhari, President of the Federal Republic of Nigeria, and of the government of Nigeria, to His Excellency President Donald Trump and the United States government for the generous consideration and friendly gesture. We particularly appreciate that this gift comes against the backdrop that the United States is itself also fighting its own fierce battle against COVID-19 plague, and we wish them the very best in dealing with this challenge. Ladies and gentlemen, we have witnessed the severity of the impact of COVID-19 outbreak on health systems, economy, and social structure of all nations, especially on the low and lower middle income countries of the world. Since the first case of COVID-19 was confirmed in Lagos, Nigeria, on the 27th of February, life has also drastically changed for us. We have worked hard to cope with and, where necessary, adjust to the changes. The Federal Ministry of Health and its public health agency, the Nigeria Center for Disease Control, have focused on providing guidance to tackle the challenge. Our health workers have been trained and equipped and are doing the needful to attend to COVID-19 patients and to give emergency care while not losing sight of routine and essential health services. I believe they and the people of Nigeria are encouraged and reassured by the arrival of these ventilators to facilitate critical care aspects of treatment. The Presidential Task Force on COVID-19 Response is an interministerial whole of government entity established to develop a common strategy and provide guidance that best protects the people of Nigeria across all fronts. Its activities include supporting medical response, regulating neighborhood security and social activities, managing movement and travel restrictions, overseeing environmental impact, promoting non-pharmaceutical measures, and also promoting economic palliatives. At this point, I wish to also commend the United States Agency for International Development and the US CDC, and especially also the US Ambassador to Nigeria, Her Excellency Mary Beth Leonard, for their interest and engagement in Nigeria, even beyond and before the advent of COVID-19. Her Excellency has demonstrated personal concern by paying a solidarity visit to the Federal Ministry of Health. I wish to conclude by requesting the United States government to lend its full weight to global efforts to find efficacious therapeutics and vaccines to neutralize the threat of COVID-19 to the global community, and to guarantee fair allocation to all countries and people. The speed and ease with which COVID-19 has spread across the globe clearly shows that it is a threat to all mankind. Without the full collaboration of all nations, the threat of COVID-19 to any one part of the world is a threat to all. I use this opportunity to salute and recognize the presence of members of the media here present today, and also to appreciate their role in the fight against COVID-19 pandemic. You are all important partners in the messaging strategy, which helps to give the correct picture to citizens and to combat spread of fear and panic. We value your partnership and shall work to strengthen the relationship with you all. Thank you very much for listening.
The Abuja Premier Medical Warehouse, which you just heard a few moments ago, was just established in 2017 in partnership with the government of Nigeria, with the Global Fund and USAID. It's great to be here as the US government presents life-saving equipment to the government of Nigeria and its citizens. The 200 ventilators being transferred today are compact and portable and can be easily mobilized to reach those patients with the most severe symptoms of COVID-19. Their arrival fulfills the commitment discussed between Presidents Trump and Buhari earlier this year. Our support includes training on the use and maintenance of this equipment, ensuring that the ventilators can address other respiratory illnesses in the years beyond the virus. USAID will work very closely and energetically over the next couple of weeks with the Ministry of Health and the Presidential Task Force to bring these ventilators across each and every one of Nigeria's states and the FCT. In fighting the COVID pandemic, it's critically important that doctors have adequate access to medical oxygen, as these ventilators depend on a reliable supply to be effective in treating patients with severe symptoms. The US has been pivotal in supporting Nigeria's membership in the Every Breath Counts coalition. Nigeria is now one of just 2 countries in Africa to have an oxygen roadmap that seeks to fight against pneumonia, hypoxemia, and now COVID-19. While we all continue to face unprecedented challenges as a result of COVID-19, I would like to laud Nigeria's efforts in taking early action to combat and mitigate its spread. I hope to see Nigeria continue this trajectory as an example for all to follow. Decades of past US investments in the health sector have equipped Nigeria to move quickly and effectively in responding to previous outbreaks like Ebola. And these improvements in health infrastructure are an enduring legacy that will drive the response to COVID-19 and other outbreaks. Having provided Nigeria with over $56 million in COVID-19 assistance to date, the United States remains committed to partnering with Nigeria to shape its COVID-19 prevention and response efforts. We will continue to rapidly pivot and adapt our activities and strategies as needed. In fact, this gift of ventilators and the many other health and humanitarian programs offered through the American people over the years is just one component of the strong and continued cooperation between our 2 governments. As we celebrate 60 years of US-Nigerian diplomatic relations this year, it is deeply satisfying for me to look back on the many ways we've worked together to improve the safety and well-being of the Nigerian people. whether through military, medical, or vocational training, or the renovation of schools, hospitals, and most recently, 9 state emergency operations centers. As the U.S. ambassador to Nigeria, I remain proud of the strong friendship between our two countries. Working together in partnership with this country's government and its citizens, the American people are committed to working with Nigeria to implement effective disease surveillance and improve its capacity to safely isolate and treat confirmed cases as we look ahead to a virus-free Nigeria. Thank you all so much for your kind attention. It looks like a doll.
So the ventilator place we need to say yes. Impressed want to see you. So, to the glory of God and to humanity. Congratulations. Let's put our hands together.
Ventilators are particularly useful, and these ones that we have received here are very modern in that you can grade the pressure, and it is electronically controlled. Yes, so the use of ventilators and oxygen will reduce mortality, and the aim of the Ministry of Health is to reduce mortality to less than 1%.
I think, you heard the minister talk about, the sharing of vaccines, and also talking about the fact that the United States is making this donation, despite the fact that we have, of course, are facing COVID-19 at home as well. And I think that speaks to the fact that the United States understands and has always understood as a leader in international health that diseases cannot only be treated in one country, that it must be a worldwide cooperative endeavor. And that's why we're assisting other nations, even as we are working on the problem at home ourselves. And I have every expectation that that same principle will guide our actions and responses once we get to the happy day when there's a vaccine. So as you know, that the United States has expressed some reservations about the practices of the WHO. And so we're currently looking at ways that we can work through other partners, but without undercutting the financial commitment and the commitment that we have to international health. And I expect that that will continue. Thanks.